The oral health of people in rural areas is poorer than that of people in capital city areas, such as with complete tooth loss, missing teeth and tooth decay. We also know that in research to be published in the Australian Dental Journal next year, that although the oral health of rural people has improved since the late 1980s, that the gap between city people and rural people has basically stayed the same. In other words, they've both improved at the same rate, but you're still much worse in the rural areas. Dentists in rural areas are older. They're my age. How does that sound? And we like to think about retirement over the next next 10 years, and so possibly your problems in the rural areas may get worse before they get better. The third area of need is for people who are eligible for public dental care, as was mentioned by both Martin and Bart. Being ineligible for a public care was associated with more likely to have made a recent visit in the last 12 months, and people who were eligible were much more likely to not have visited in the last 5 years. This has resulted in the maldistribution of the dental health between different socioeconomic groups. And so we know that people with public dental care who are eligible for public dental care are more likely than other Australians to suffer tooth loss, untreated tooth decay and gum disease. So we ask, what can the ISC do about this inequitable access to dental care? The ADA believes that we need a future dental workforce that can provide services that are population-based, are patient-focused, and as Newell would say, family-focused, that are preventively orientated and ensure an adequate dental workforce in areas of greatest dental care need. What we find, though, is that dentists in rural and remote areas need to be what I like to call super generalists. They need to be the best in the profession. Basically, they haven't got a specialist down North Terrace or something like this that they can refer to if things aren't going well and or the more complicated procedures. Special needs dentistry is a new speciality, and it's an area whereabouts you need to know more and more. Again, we need the best of our profession in that area. People in aged care facilities often have medical conditions, and I note that Martin flashed up a slide of Karen Alexander, who is a respected dentist here and on the federal exec of the ADA, giving treatment to an aged care patient. And so again, this is where we need the best in the profession working in this area. So we think that simply ramping up the number of dental clinicians will not necessarily mean that we'll have more dentists in these areas of need. The assumption behind ramping up dentists kind of works on the market model, the demand-supply model, that says if you have more dentists, you have more supply. If you have the same amount of demand, what's going to happen is that dentists will go into areas that some may consider to be not as attractive as others. Well, we argue that dentistry is really, even though we argue that yes, it does have some market forces affecting it, that it is not completely, like most health services, driven by market forces. And that what could happen is that if you increase the number of dentists, that you might end up with those who are accessing care at the moment getting more care, those who can't seem to access care at the moment still not being able to access care. And that was a problem that Bart mentioned. So instead of ramping up dentists willy-nilly, what we need is targeted policies to address the oral health inequalities. So first of all, we need incentives to move to rural areas. So the ADA has many suggestions in this area, such as the universities use enrolment practices that increase the number of rural dental students. However, at the end of the day, we need collaborative research into this area that involves the Department of Health, universities and other stakeholders. We also need suitable care facilities. The number of times I've walked into an aged care facility and been given a torch where the battery doesn't work very well and tried to peer into someone's mouth and try and do something, has been incredible, and then they wonder why you don't want to go back. Basically, you need these facilities to be able to do adequate and proper care. We also see a role in oral health promotion and oral hygiene for other health workers, such as Martin was talking about, has been done here in South Australia by the pilot program that Ian Fricker has worked on. We also agree with Archana Pradhan, who is here at the University of Adelaide, that there is limited information about access and barriers to dental care among adults with disabilities, and more research needs to be done. And the shortage of dentists in special needs dentistry and treatment costs needs to be addressed. And I shudder to say we need more Sharon Liberales around. The ADAC Australia needs an increase in its preventively orientated oral and general health care workers. And so we see this as involving training areas where the Health Industry Skills Council could play a large role. So we'd like to see an expansion in the numbers of dental hygienists, further training of dental assistants, and training in oral health promotion and in oral health screening for staff who care for the aged and disabled. As dentists, we greatly appreciate the role played by dental assistants in their chairside role. And we have noted that so far the speakers have been talking about people outside the oral health workforce, and we can see that in this area is one that the ISC could play more of a role. We could see that extra training for dental assistants who already have their Certificate 3 could be training at Certificate 4 level in oral health promotion, in this radiography when they're assisting, to also in general anaesthesia and conscious sedation, and in dental practice administration. We would also like to see, and I would say, a massive expansion in the training places for dental hygienists. We think this has massive potential for the vet sector. The dental hygienist course at Gillies Plain has high standard amongst dentists in the private sector. We particularly like that entry into the course involves dental assistants. And as Bart said, part of the problem that we face is that dental assistants don't have a good career path, and this is a good method of encouraging such a career path. We'd like to see the dental hygiene course accredited by the Australian Dental Council, but any training that's done, we'd like to incorporate the principles of team dentistry and family-based renewal. So basically, we'd like to see that whole families are treated, and to do so, the best way is to have a whole team of approach. The ADA also agrees in principle to the National Oral Health Plan recommendation to develop oral health and oral health promotion modules for inclusion in the training of health and community service practitioners and teachers. This could nearly be the same Certificate 4 course that could be made available to dental assistants. So, as I mentioned previously, care of the aged and disabled involves a high level of knowledge. So this means that the direction and control of the dental care in institutions should be by dentists. However, some of this care may be provided by suitably trained allied dental personnel. Further, staff in institutions should have an appreciation of the need for dental care of aged and disabled people, and should be able to assist in oral hygiene. Now, as Martin has just mentioned, a lot of work has been done in this area, and I'd just like to mention that Jane Chalmers, may she rest in peace, had a lot to do with the initiation of the project. So in summary, the role of the ADACs for the Health Industry Skills Council is further training or a large expansion in the number of the preventively based dental hygienists, further training of dental assistants, oral health promotion and screening, health training for staff who care for the aged and disabled, and oral health promotion and screening health training for staff who care for the aged and the disabled. Thank you.